Hello, everyone. Welcome to the 18th episode of the AI Healthcare Podcast. I'm your host, Dylan Reed, and today we are joined with my friend, Arlen Meyers, President and CEO of the Society of Physician Entrepreneurs. Thank you for your time today, Arlen.
Yeah, thanks for having me.
And when did you realize that healthcare had to adopt to artificial intelligence?
Um, well, it's kind of a leading question. I'm not sure that they have yet. And by that, I mean that obviously artificial intelligence has popped on the radar and massively scaled in the last year.
Mm-hmm.
But it's primarily first of all, it's not healthcare, it's sick care.
Mm-hmm.
And that has relevance maybe in a future comment. But, we spend, the United States sick care spend is now 4.5 trillion.
Mm-hmm.
It's projected to be 6 trillion in 5 years, and 95 to 96% of that money is
Mm-hmm.
spent taking care of sick people, not preventing illness, chronic disease management, prevention health, public health infrastructure, all that stuff. So we're still at a sick care stage,
Mm-hmm.
which is not sustainable. Now, every year, people like me say it's not sustainable. I mean, we had the same conversation 25 years ago where we said it's not sustainable, and every year it goes up.
Mm-hmm.
So at some point, the bubble's going to pop. It's just a question of how,
Mm-hmm.
or until we change how we think about the system.
Mm-hmm.
That is transforming sick care to healthcare. So one is, and the big problem, and ultimately I'll answer your question, but this is the backdrop. Ultimately, the international problem is there is an almost infinite demand for care with limited resources. So at this point, everyone is trying to optimize what they have to take care of an ever increasing demand for care that is primarily all over the world, that is primarily driven by an aging population, global aging, including the United States, dropping birth rates, including the United States. Italy and South Korea are the biggest examples, and China, and the United States. And in fact, the population of the world is expected to plateau in, I don't know, 10, 15, 20 years.
Mm-hmm.
Um, and immigration, which is a whole nother story. So the idea is there's two ways to deal with this problem. The problem being not enough resources to take care of the demand.
Mm-hmm.
One is increase the supply or make the existing supply more efficient and effective. The second is to reduce the demand or both.
Mm-hmm.
Now, your question was, having said that, when did I realize that AI, was a necessary part of sick care? I didn't. And I don't think that artificial intelligence can solve sick care. I don't think it can just be AI to move sick care to healthcare.
Mm-hmm.
It's too complicated of a problem. It's a wicked problem. It's got multiple stakeholders with multiple agendas. Everybody wants something different. The whole notion of it being a capitalistic business
Mm-hmm.
drives basically the emphasis on short-term stock price and stakeholder value, private equity, corporatization, financialization, et cetera, et cetera, et cetera.
Mm-hmm.
Now, is artificial intelligence being used in sick care? Yeah, it's being used in primarily three areas. One is operations, second is finance, third is clinical. The vast majority of what has been implemented so far, as far as artificial intelligence in healthcare, has been operations and finance, remote remote process automation, repetitive tasks, GPT, large language models, generating documents, revenue cycle management, fintech, all that stuff. If you look at the clinical applications, the FDA has approved 500 software as a medical device, so-called clinical decision support systems. There is more resistance to its application in medicine and clinical care, that
Mm-hmm.
is, health doctors and other health professionals, because primarily we don't trust it. In many respects, it's a broken product. And you got to ask yourself, why is everybody getting so crazy about a broken product? And oh, by the way, we're the ones who are paying to fix it.
Mm-hmm.
In other words, we're creating the content, we're creating the copyrights. The New York Times is creating their stories, but the LLM model makers are taking the stuff to improve their product
Mm-hmm.
without paying anybody to do it. So to me, the whole model sort of doesn't make sense, and
Mm-hmm.
people are pushing back. So what happens? Copyright laws, legal aspects of AI, ethics, et cetera, et cetera, et cetera. Who pays? And that's another issue: is who's going to pay for all this stuff, let alone the earth, because AI screws up the earth.
Mm-hmm.
It churns up a bunch of water. It emits a lot of stuff when you generate the electricity. So there's a whole bunch of issues that have to be solved. And finally, doctors, healthcare executives, and more importantly, patients don't trust it.
Mm-hmm.
So I just think we got a long way to go before it becomes part and parcel of what we do, let alone
Mm-hmm.
there is no silver bullet. AI will not, or artificial or private equity, I don't care who it is, there is not going to be a silver bullet to move sick care to healthcare.
Mm-hmm.
Lots of folks are going to try. Lots of folks are going to make a lot of money doing it. Lots of people are going to lose a lot of money doing it.
Mm-hmm.
But ultimately, I think we're going to have to figure this out. It just has to be a different business model. We can't keep doing what we're doing and throwing good money after bad.
Mm-hmm. And you actually brought up an interesting point earlier about us having the same conversation 25 years ago. Because I really didn't have an understanding of the ramifications back then. But what was the difference between, because the Clinton administration tried to do something similar, what was the difference between the 90s under Clinton versus the mid 2000s under the Obama administration when it came to healthcare?
One vote. I mean, it just came down to power politics. That healthcare reform has been 100 years war. The first healthcare reform effort was Teddy Roosevelt in 1912. We've been fighting this battle for 100 years. So it really just comes down to the votes. Now, so what the answer to your question is, because the political landscape has shifted. Now it's even worse because now we have what's going on, red medicine versus blue medicine, and everything that's going on in geopolitics, disinformation, social, et cetera, et cetera, et cetera, regardless of what side you're on, that just makes the conversation more difficult to fix it.
Mm-hmm.
So I don't see on either side. And then there's this whole issue of the Wall Street Journal just recently had an article that was entitled "The Growth of the Welfare Industrial State," and their terms, not mine. And uh, the idea was that if you look at the recent economy and labor market statistics, the biggest jump has been in social services, government, and healthcare. That goes to, in large part, taking care of people who are in the country illegally.
Mm-hmm.
So it has to do that's why it's a wicked problem. It's immigration, it's multi-systems engineering, it's homelessness, it's all the stuff that comes together in making this system work.
Mm-hmm.
So it's California just passed a law. They're going to pay for anybody that comes into California, and they're going to enroll them in Medi-Cal, which is their Medicaid program. Well, that costs a lot of money. Somebody has to pay for that.
Mm-hmm. No, that's very insightful. And one of the articles that you actually sent me beforehand was this idea of like physician entrepreneurship. So could you just describe what physician entrepreneurship is, and what would you say has been the biggest cause of its decline?
Well, two separate questions, and again, it's sort of a presumptive close. I'm not sure it's in decline, but let's deal with that on the second point.
Mm-hmm.
So the first point is, what is physician entrepreneurship? So the traditional notion of entrepreneurship has myopically, in my view, been it's somebody who creates a company. Well, that's not what we are talking about, or I'm talking about, when we created the Society of Physician Entrepreneurs. And so my definition of physician entrepreneurship is the pursuit of opportunity, primarily in sick care, biomedical or clinical innovation, um, under volatile, uncertain, complex, and ambiguous conditions, so called VUCA conditions,
Mm-hmm.
with the goal of providing stakeholder defined value. One of those stakeholders, obviously, is the patient. Another stakeholder and multiple stakeholders are those that control the system: payers, providers, people who produce stuff, politicians, policymakers. The reason we have the system that we have.
Mm-hmm.
So it's the goal is to create user defined or stakeholder defined value
Mm-hmm.
through the deployment of innovation using a viable business model with the goal of achieving the sextuple aim. Now, each of those parts of that definition, again, we could go down a conversation about what it all means, but
Mm-hmm.
the headline is physician entrepreneurship. And when I say physician, I mean healthcare professional. It could be a nurse, doctor, whatever.
Mm-hmm.
Um, uh, the idea is much more than just creating a company, a spin out. You could be a social entrepreneur. You could be a medical practice entrepreneur. You could be a service provider working with other physician entrepreneurs. Most doctors now are tasked with being an intrapreneur because they're employees. They work for the man.
Mm-hmm.
And, there's like 5 companies that control the vast majority of doctors who are working in the United States now. So their task is create value, not just for the patient, everything else, but for the person who is signing your paycheck. So the man, or in this case, the woman who is running the hospital that employs you, expects you to generate value, not create a company, create value within the organization through the deployment of innovation, using a viable business model to achieve the sextuple aim. And you know what happens if you don't? Your white coat gets the pink slip. So that's what we're trying to do. We, meaning the Society of Physician Entrepreneurs, we're trying to give members, it's an open innovation network, anybody can join.
Mm-hmm.
So we're trying to give our members education and access to resources, networks, mentors, peer support, non-clinical career guidance, experience, so that they can satisfy the definition that I just described.
Mm-hmm.
Why? Because we're not going to be able to fix this mess. We're going to have to innovate our way out of it
Mm-hmm.
based on what I said in the beginning. The existing model is broken. The only way to fix it is to figure out different ways to satisfy the almost infinite demand for care with limited resources around the world. And in so doing, achieve our vision, which is to close essentially UN Sustainable Development Goal number 3,
Mm-hmm.
which is disparate health outcomes around the world.
No, No, that's very insightful. And kind of just piggybacking off of what you just said, what are some of the common situations that members, without naming names or organizations, from the Society of Physician Entrepreneurs have come to you and are like, hey, this is a problem specifically in the nursing space or the medical space
Right.
from the doctor side or from the business side? Kind of what have you seen are common trends heading into 2024 that either are opportunities or threats?
Well, first of all, when people ask me, what is the Society of Physician Entrepreneurs created?
Hmm.
We're a dating service. We're just a matching, two-sided market matching platform. I tell folks, I make dates, I don't make babies. The people in the network make the babies.
Hmm.
So I don't take credit. I take credit for creating the platform,
Hmm.
but I didn't, I mean, I've created my own stuff. I've had my own companies and whatever. But to your question, we just connect dots.
Hmm.
And if you have questions or issues or whatever, you contact somebody in the network to help you. Um, as far as the trends that I see, uh, I would say that number one, and this gets to the second part of your other question, why do you think physician entrepreneur is dropping? Well, first of all, I don't know whether physician entrepreneur is dropping. Nobody has that information or that data, so I can't give you an informed answer.
Hmm.
I can give you a biased answer and say, yeah, sure, we're doing our stuff. Everybody's doing. It's not true. I don't know. It's not true.
Hmm.
What my back of the envelope observation is that there's about slightly over more than 1 million practicing physicians,
Hmm.
active clinicians in the United States. My view is about 1 to 2% of them have an entrepreneurial mindset. So we're talking, that's a whole nother conversation about medical education and why do they get picked and how come they're not creative and all that other stuff. But the point is, I don't really think that has substantially changed. And it's gradually changing. And one of our other goals is to transform medical education to include innovation and entrepreneurship. And incidentally, a recent review of 177 allopathic medical schools showed that slightly more than 15% offered some sort of education in innovation and entrepreneurship. So we have a long way to go, and that doesn't include 36 or 38 osteopathic medical schools. So we got a long way to go in terms of getting people up to speed.
Hmm.
Um, the second point is uh, that a lot of this depends that most of the ideas that people come to me with,
Hmm.
because this happens all the time. They call up and they say, Arlen, I got an idea. Do you mind me picking your brain, all this stuff? And what I tell them is, it does not matter what I think. It doesn't matter. The only thing that matters is who's your customer and what do they think. I can tell you ideas to you green in the face, but it doesn't make any difference until you go out and actually do the business model canvas or test the idea or do some lean startup methodology or all the stuff that most people know about these days. So I think we still have a mentality of people being a problem solver instead of a problem seeker.
Hmm.
I don't think enough people understand how important it is to define the problem first and who's got it, who cares, who's going to pay, how much, what are the issues, all that stuff. I also think they underestimate the time and effort that goes into this. And frankly, uh, there are a lot of grumpy doctors, and I think that's kind of changing a little bit because as the pandemic has it hasn't gone away, obviously, but it's settled down. Uh, People are rethinking, well, do I really want to quit being a doctor? Despite all the burnout talk, despite all the grumpy talk, being a doctor is a pretty good gig when you think about it in
Hmm.
terms of just everything that goes with it. You're in a very fortunate position. So you really need to think hard about whether you want to hang up that white coat or tell them to shove it where the sun doesn't shine. And third, this brings up the 0 to 1 concept. There are just too many people doing the same thing in different places. They're taking old wine and putting it in a new bottle. They're taking ideas. There's this old saying that by the time you see a market map with 150 competitors on it, it's too late. You want to play in a place where there aren't any competitors because you created something like new and it hasn't really started moving along yet. So I just think there's too much me too. It's what Peter Thiel refers to as, n plus one instead of 0 to 1.
Mm-hmm.
So I just don't think there's that much true innovation coming out.
Mm-hmm.
And to make matters even worse, I think the term innovation has become so dumbed down
Mm-hmm.
that anybody that comes up with anything that they think is new is declared to be innovative, which I think causes a lot of problems.
Mm-hmm. That's very insightful and very helpful to hear from your perspective on that matter. And Arlen, the last question I did have for you is what is one thing that you think Congress or elected officials must understand about physician entrepreneurship when implementing AI healthcare policy in the United States?
Well, physician entrepreneurs participate in the process in many, many different ways. When it comes to, I mean, the government's role in entrepreneurship is vast.
Mm-hmm.
It primarily has to do with rules. And the overlying notion is that rules create ecosystems. Ecosystems create, in any industry, rules create ecosystems. Ecosystems create business models. Business models either get in the way or facilitate the acceleration of innovation into the marketplace, such that it creates value. Any industry, the most recent one is artificial intelligence.
Mm-hmm.
Another is electric cars. I mean, the dissemination of electric vehicles in part has to do with the technology, in part it has to do with the supply chain, but a lot of it has to do with just the fact that there's not a reliable electric grid and people have grid anxiety. They're afraid they're going to run out of juice in the middle of Wyoming. So it's like, I call it the single fax phenomenon. It doesn't do you any good to have a single fax machine. You have to have a network of fax machines. It
Mm-hmm.
doesn't do you any good to have a television set without a network that creates the programs to the machine.
Mm-hmm.
All of that is pretty much regulated and controlled by the government. So when it comes to physician entrepreneurship, the headline is our interest is appropriate regulation. I don't think you could just turn this loose. Um, and it's not any different than what we're doing with drugs and devices in the FDA. And that goes back many, many years to, the 1920s, 1930s, when we had unregulated drugs that were killing people. So the real balance is between what serves the interest of the public health and what serves the interest of innovation and economic development. So my plea to the government and to technologies industry and to the techno industrial complex is, and we're doing that, we're trying to figure out how do we regulate artificial intelligence in sick care.
Mm-hmm.
And that's going to impact the involvement of physician entrepreneurs, not only as advisors or people who inform their thinking, because we work in a very complicated industry that most people don't understand unless you're really working in it. Um, and as entrepreneurs creating ideas and trying to get them to market, it significantly impacts our ability to raise money and do so.
Mm-hmm.
So if you have to jump through a whole bunch of hoops, the latest is software is a medical device. Is it a medical device? Is it not a medical device? If it is, then what do you have to do to get it approved? And how much is it going to cost? And how long is it going to take? Et cetera, et cetera, et cetera. So each one of these rules and regs is going to have an impact on the ultimate outcome, obviously.
Mm-hmm. So, and where can people find more about you, Arlen?
Uh, well, if you, as my wife said, be careful what you ask for. Uh, um, I'm all over the internet, and the best way to get me is I'm at the Society of Physician Entrepreneurs is www.sopenet.org. I'm on LinkedIn. I write a lot of social media stuff. I write a lot of stuff. So if you're interested in finding me, you shouldn't have a problem doing so.
Okay, great. Thank you again. And do not forget to hit the like button and subscribe to my YouTube channel. Podcast episodes are also available on Spotify and Apple Podcasts. And do not forget to check out my newsletter, the AI Healthcare Report, on LinkedIn. This is Dylan Reed signing off. Thank you again, Arlen.
Yeah, thanks for having me.